as well as with Asociación Humano that also has a self. In the case of sex workers, we have been able to do some coordinations with cancer organizations, women, breast cancer. So we refer there, and with the Instituto de Alcoholismo y Farmacodependencia, the alcohol center from the government, that has been already sensitized, and we are coordinating and we are making referrals to them. And that's some examples according to each population and vary country by country. The important thing is that in some cases we used to do just HIV prevention and just like give the message. But when we really started entering to that structural, with that structural approach, we have realized that there are other needs that are being barriers for adopting healthy behaviors. I remember being in Nicaragua in an activity, and when we were just discussing some other possible needs that the population may have, 5 of the 6 girls that were with us didn't have an ID. And because of the ID, they were not able to access to any other work. And that's why they felt that they had to be there. And they thought that the ID was expensive and difficult, and it's free and it's easy. So then in the next Sweeping the Zone activity, the program made coordinations with the mayor office, and a kiosk for IDs was there in the market, close to the market. So girls were able then to ask for that. And just that changed completely their self-esteem, everything. So sometimes now that's why this structural approach is really like opening other doors to the traditional HIV prevention we have done. Other activities, and this is all the innovation that we have in the program, is social media. We developed and launched a new website that is called ¿Y ahora qué? Or And What Now? It's in Spanish and in English because of the list, everything we do has to be done in English too, so that is good. And here is where we created this new position that are cyber educators. So cyber educators implement and do virtual outreaches. And this is because people even with AIDS, it's not difficult to reach, but not everybody wants to be public. So sometimes when you receive your positive result, we can lose that person if that person doesn't want to be part of a self-help group or something like that. So the website is being now a tool to keep the contact and make sure that we clarify doubts and give the right information. And it's also it's a practical website, not a technical one. So for family and friends, is resulting very effective too. And also important that in the website we have a section that is that are support groups. Right now, three support groups are working for men and women living with AIDS, for family and friends, and for discordant couples. And we collect the UIC there. So we are able to track the UIC, enter it to the SAM system, to the database, and include that also as part of the results. And we are implementing the communication strategy, and we have also developed a virtual voucher for the biomedical services. So if when we are doing the virtual outreach, we identify that there's a need of a PCT or a STI diagnosis, we send the link. The link can be opened just once and has a life of 24 hours. So you enter your UIC, you print it, and then you can go to the clinic and receive the service. Other activities, Regina, but this is useful for us. Last year, Miss Universe visited the region. This type of activities create a lot of awareness and result very effective for the program because everybody talks about the government, the media in general, donors, etc. And with the visit of Miss Universe, because she was Mexican, she went and did the test in one of the IPPF clinics. We received a lot of media coverage. We did some activities with trans population. So it was a very positive experience with very good results. Also, on the result too, and this is very important for us, so how we will address all these structural factors. We just completed a research, a qualitative research using the focus on segmentation methodology, and we developed archetypes of the discriminators, because there were a lot of information in the region about the target populations or the health providers, and we all know that they discriminate or are victims of discrimination, but we really didn't have enough information from the other perspective, that is in general population. So we decided to understand 3 levels of influencers, and one was fathers and mothers, because we learn from them. That's the first way, or the first area where we receive information. Teachers and directors of schools, or principals, you say, and community leaders.